our quite live discussions about mental health, mental illness. Tonight, we're on every Monday, Wednesday, and Friday at 9 p.m. Mountain Time. So thank you for everybody who's tuned in. Had a couple questions come to me. I want to talk a little bit about the topic tonight is who are you? Who am I? A lot of people, this is a very existential question to be able to ask yourself, who am I? What am I? Why am I the way I am? And, this is a constant theme that I go back to, is the idea that a lot of times we're overly identifying with our conditioning, meaning that we think we are somebody who we're not, because what's layered over us over time is conditioning, is learned behavior, is people telling us over and over and over who we are. They're either hurting us, they're affecting our self-esteem, they're making us believe certain things about ourselves. So again, if you're catching this live, please ask a question. Tonight's topic is, who am I? Who are you? Why is this important? So people would say, well, why is it important? I'm Stephen Walker. I'm Bill Smith, whatever. The problem that I see in the mental health field is that people many times will come to me with an idea of who they are. So I hear the expression all the time, not all the time, but a lot of the times, I'm the type of person. I'm the type of person who this. I'm the type of person who that. And in reality, until you really begin kind of chiseling away at some of that conditioning, we really don't have a pretty good idea of who we are, because a lot of who we think we are. Hey, Kimberly. Hey, Miranda. Hey, Janie. Thank you for tuning in again. Please share this. Let's pull some more people in. Really appreciate everyone's support. There have been some core supporters from the get-go who have always tuned in. Thank you. The idea of what I'm trying to do here is that we all log on, we all normalize conversations about mental health. I give you some clinical impressions and ideas of what you need to work on, and then you make the decision of what you want to work on. But like I said before, who am I? Why is that important? A lot of times we identify with our trauma as though that is who we are. And I use the idea of racism a lot, the idea of that somebody who's a racist. There are no born racists. Nobody's born hating black people, hating white people. But if you teach a child that long enough, they begin identifying with themselves as being a racist, meaning that I don't like this black person, or I don't like this white person, or I don't like this immigrant, or whatever. And the racism, hey, Angie, I think I got your question. Angie had asked a question about anger, and I'll get to that in a sec. But the reason questions about who am I are so valuable is because it gets us past the surface layer of who we're identifying with. So let's say somebody's listening to this, and for years they've struggled with some form of trauma. So that begins to be their self-identity. So they begin to identify with that. It's kind of like when you see somebody who's been diagnosed with like cancer or something, or some physical illness. What's the first thing they say? I have this. They begin owning it as a self-identity. So I'm assuming other mental health people do. I know I do it quite heavily, is I draw on existential psychotherapy a lot. The bigger questions about who we are and why we are the way we are, in my opinion, are fundamental to helping people overcome trauma and work through a lot of dysfunctional learned behavior. That's the key. Most of what we struggle with is learned behavior. It's behavior over time that has set in as our self-identity. And then the next thing we know, that's who we are. So I'm going to get to some questions in a second, but why I encourage people to ask themselves who they are, it's because then they can begin to get some hope. They can begin to develop an idea that the person that I think that I am may not be that person. Who is beneath that? What is this self-identity? And people talk about, the authentic self, and Eckhart Tolle. I don't know if you've heard of him, but he's done a lot of writing about this. He's more of a spiritual. There's some of his stuff is good, and a lot of it is good, and some of it's a little hard to follow sometimes. But he and other writers have talked for years. A lot of philosophers have talked about getting to the core of who we are. So again, I don't want to go on and on because, like I said before, these talks are not about me letting everyone know how brilliant I am. It's about interacting with you guys. So if you have a question, please, first off, please share this. Okay, please share the broadcast so we can pull some people in. And then if you have a question or comment, please do. I'm going to get to Angie's question and see how many people can resonate with that. Can you talk about anger and how to deal with that, especially in kids and teens? My son is 12 to 13 next month. He has been diagnosed with ADHD and oppositional defiant disorder. He isn't medicated for that as yet. He has type 1 diabetes. Wow. Pretty sure he's pissed about that, Angie. Can play a huge role in his attitudes and behaviors. Exactly. He always been one of those when upset or nervous or scared and acts out and throwing tantrums. He has often said he's depressed and talks about how he wished he was dead because nobody wants him around. Some of this, I think, is he says just because he is not happy or feeling sorry for himself about not getting his way. I worry that my own struggle with depression, self-harm, suicide attempts, and ideation affect him and making him say things like that. He's depressed or he should just die, that he wants to die. This is some very difficult things to be dealing with as a parent. So I'm not going to read the whole thing. This is hard for me because he is very much like his dad. So she's saying that when he yells at her, the screaming and yelling is what he really gets me, the words. I haven't much success in him talking it out. He screams, he throws tantrums. Family has told me all of his life that his behavior is a result of me not punishing him enough severely, but I've seen that doesn't help. Well, Angie, that's a lot to be dealing with because not only are you dealing with what you're going through personally, but you're having your son who is, obviously going through puberty too. He's saying things to you in a way that triggers your underlying trauma. So the main thing I would do would be to try to catch him, because when the fire's burning, you got to just wait for it to go out. You can set boundaries and, no physical violence. And if he ever attacks you, then he needs to know that that's unacceptable behavior and there'll be consequences. But what I would recommend for you, Angie, is you got to get him in a time where he's not angry, when he's not activated, and you've got to sit him down and try to and I know you maybe have tried this, but you've got to keep trying it. You've got to try to pick at, first off, what he's angry at you about. Now, again, remember, this is not about blaming mom or anything like that. This is about simply engaging with your son at a level where he feels you trying to empathize with him. And remember, like I've said before, empathy is not agreeing with somebody. Empathy is trying to feel for somebody. So I would recommend that you try to let him know, wow, honey, it must be hard having type 1 diabetes. I worked with a kid who was in kindergarten when I was doing my doctoral work in Hawaii, and he had a insulin pump, and he was angry, his parents. Anyway, so I know how that changes self-identity. When you're diagnosed with that, now you're immediately different than everyone else. And that's the last thing a kid going through puberty wants, to think of himself as different than somebody else. So I would try to sit him down and just empathize with him. Like try to even expose yourself to a certain degree, like saying, honey, has my mental illness or have my issues affected you? I want to hear about that. Try to come at him in a respectful way. I've worked with, in multiple clinical settings, multiple treatment facilities with adolescents, schools, prisons, the whole 9 yards. But when I've worked with teenagers, there's a reoccurring desire for respect. And I know a lot of parents say, well, they don't respect me, I'm not going to respect them. But the problem with that is somebody's got to be the adult. So kids will oftentimes give what they get. If they feel disrespected, if they feel you're being a hypocrite by saying, yelling at me and you don't want me to yell at you, and he's a teenager now. You've got to try to empathize with him and try to have him feel that you're trying to feel for him. See, the thing about empathy, which a lot of people don't get, is that when you feel another human being trying to feel for you, even if you're wrong, that person starts helping you understand them. Meaning it's this weird, I don't know, people have studied and talked about empathy for years, but it's like this weird connection that happens in a person's mind where they all of a sudden something clicks and they're like, oh wow, they're trying, so let me help them understand me. And teenagers to a fault have told me, my parents expect respect and don't give it. Okay? This is part of the problem going on in most families. They're stuck in this, well, it's me, it's you, you're not giving it. And then it's just a whole bunch of finger pointing. With your son, again, guys, if you're watching this live, please ask a question or make a comment, okay? Remember, this is about engaging with a licensed psychologist and talking about your issues, because there's nothing wrong with having issues. Everyone has issues, okay? My website, everyonehasissues.com. So Angie, you've got to try to get him when he's calm. If he likes McDonald's, if he likes, I don't know, a certain food or a certain place, I'm not rewarding that behavior. That's not the point. You want to disarm him and try to figure out what is going on with him. Empathy is one of the most powerful forms of therapeutic alliance that people in our field use. Some are good, some are not. Some people come to me and they're like, oh, my whatever was this and that. Some are like, oh, my last counselor was awesome. Empathy will open people up. Empathy will make them feel heard. Empathy will make them feel respected, okay? Respect is the key issue. Respect is the key issue that teenagers are looking for. And a lot of people say to me, well, I'm not going to give something that I'm not getting, meaning I'm not going to give respect if I'm not getting respect. And I hear that. And some people believe that earning respect is better than giving respect. There's not a lot of data. There's some interesting studies that came out and I talked about this before. Hey, Jennifer, how are you? Thank you. I continue to share your message. You're doing such a great service. Thank you. I'm actively in therapy and it's a great match, but you're a great addition and it gives me extra homework between my work with him. Beautiful. Please share this, Jennifer. So, respect. If the studies. So real quick, there's this thing called token economies. So token economies are what they use in treatment facilities for people to earn privileges. Okay, so there are two models with that. One model is Stephen Walker comes into the treatment facility. I'm mad. I'm angry. I don't want anything. Some counselor sits me down and says, listen, dude, this is the deal. You're at zero. You got to earn TV, internet, staying up late, telephone, whatever the privileges may be. Okay, that's one model. The other model is I come into the treatment facility, I'm mad. Counselor sits me down and says, okay, you got all the privileges. You have every privilege you have. You have TV, you're at the top you got everything. All you can do is lose it. All you can do is lose your privileges now. Now, hey, Rose, thanks for, please ask a question. Which one do you guys think is more effective? Anybody want to speculate? Well, believe it or not, the one where you're given everything at first and all you can do is lose it is actually showing more effectiveness. Why is that? What the studies are finding is that people will fight to keep something they already have a lot more than earn some distant idea of a privilege. And what they're finding is when you get, like what I found is I go into I've worked in with some of the worst offending people you can imagine. Exactly. Angie, I go in, I tell them straight off the bat, you got all my respect. You have all my respect. All you can do is lose it. And to this date, after over 20 years I have never been attacked. I have never had anything negative happen to me. The only time I made a stupid mistake playing with this guy who was in there for beating somebody up, and we had a hardest hit competition. Needless to say, I'll never do that again. But anyway, I found that this disarms teenagers immediately, because when a kid starts disrespecting me, I'll say, whoa, Bill, you're being real disrespectful here. Have I disrespected you? And then they'll think, oh, no, man, you're right. It's this guy over here. I'm the one. So this is what I'm saying to you, Angie, is try to engage with him at a level of respect and empathy, okay? And see what you can pull out. Maybe you can pull out what he's angry about. I would guess that he's angry about, like you said in your message to me, guys, please ask a question. Who's ever watching live, please ask a question about something you're going through. Jennifer, share with us something that you're working on in therapy or whatever. And great. I love how Jennifer's proud of that she's in therapy. What the hell is to be ashamed of? I mean, if you stop and think about it, if you're going to talk to people about your dentist or whatever, what is there to be ashamed of about being in therapy? So please ask a question. So Angie, what I would recommend is you've got to be a detective. Like let him feel like, honey, what is going on with you? Why are you so angry? And it may not be the first one. First conversation. If it's not, let him know when he storms out. Hey, I'm going to ask you again. Maybe give him some privileges he's always wanted and tell him, look, we're going to switch it up a little bit. You got all these privileges. All you can do is lose them. And see if that works, or a combination of both. But we feel for you, Angie. We really do, because I know what it's like. Not I know, because my son's only 4, but I've worked with many parents struggling with this. So again, you've got to try to engage with him at a level that he feels listened to and empathize with. If you're just tuning in, we're getting more and more people logging in. Please ask a question or a comment. My name is Dr. Stephen Walker. I'm a licensed clinical psychologist. I'm making myself available 3 nights a week for an hour for people to ask questions. Jennifer, if there's something in your therapy sessions that you need some clarity on, or something different that can happen, please engage with me. If you're watching this after the fact and you're thinking, do I need some therapy? Well, let me tell you something, people. And I know that people will say, oh, well, this is self-serving and all that. Everybody could use some of this work. Like the topic of tonight was, or is, who am I? What people asking themselves that. Imagine, like I said before, the racist who doesn't want to be a racist, asking him or herself, who am I? Why am I? I mean, I'm hating this group of people and I don't even know them because they really haven't even done anything to me, and it's all learned behavior. Imagine what that can lead to. Imagine if people just start questioning the way they've been taught to learn things. Oh, I call it questioning your conditioning. Oh, asking yourself, why am I the way I am? We'd have more of that society than we've all hoped for, because people would be fundamentally dealing with their mental illness. And by mental illness, remember, I mean, everyone has mental illness on a spectrum, myself included. Everyone has a degree of mental illness. And speaking of mental illness, if somebody's catching this not live, stop leaving me these stupid ass, excuse my language, comments on my advertisements to promote this. People are spam and get off my timeline and all this. Wake up. There wouldn't be a Facebook with people not paying Facebook to advertise. If you guys think that Facebook is this, just free community, it isn't. If you see one of my ads on your timeline, I've paid for it. I have, I think, 38 or 39,000 followers. You know what Facebook does? They don't let me reach every one of them. I've got to pay Facebook to reach the followers I've already paid Facebook to reach. I had to pay in the beginning. I had to set up this page, and then I have to pay Facebook to advertise it with keywords and people who psychology and all that. Odds are everyone who is like this, I've had to pay Facebook to make you aware of this of my page. So grow up. I mean, grow up. You know, the comments, I should post some of them so people could see them, and see who's doing them. But people are leaving these nasty messages, and it doesn't bother me. It's just stupid. It's like, hello, there wouldn't be a Facebook without people advertising to Facebook. Okay, just a side note. So again, if you're watching this, please leave a message or ask me a question. This is a live broadcast, and it depends on interactions with the viewers to be successful. I could easily just make videos and post them and hope that people follow me and make money and all that, but that's not what this is about. This is about engaging with people who have never spoken to a psychologist and asking me questions like we've had before. We've had multiple people ask questions about things, and we've had some lively discussions with that. So Janie's asking, I have thought about that all my life. Who am I? I am still searching for clarity. That's an excellent question. The reason I think, Janie, and whoever else is watching, that people don't like to ask themselves, who am I, is because it brings insecurity. There's a degree of insecurity that you're hit with when you start thinking, oh man, I mean, really? I mean, when I stop and think about it, who am I? And that begins to destabilize the person. But if you ride that out and you ask yourself deeper questions and start questioning things like, why do I hate myself so much? Why do I hate myself? Why am I so scared? Why am I so worried about what people think? Why am I assuming that people think negative things about me? These are the kind of questions that emanate out of who am I? And I've talked before about, a great writer, if anybody wants to read a book called Man's Search for Meaning. It was written by a gentleman named Viktor Frankl. And in a previous broadcast, I said he wrote it while he was in a concentration camp. I misspoke. I meant he wrote it about when he was in a concentration camp. And he found that the prisoners who found meaning in something, and he talks about how he would see, and remember, this is a guy whose, family was gassed, friends, talk about trauma. But he talks about how he saw a tree outside the walls of the prison, and he would imagine himself sitting under that tree, and that gave him meaning. And what he found was that the prisoners who gave up their search for meaning, their finding a meaning, are the ones who withered away. Great book if anybody wants to look into that. But that's great that Janie's still searching for clarity. Now remember, Janie, with that comment about searching for clarity, remember, guys, clarity comes and goes. Remember, one of the most universal symbols that I like to help people with is the idea of the yin yang. There is no sustainable clarity. It's going to be clear, and then it's going to be not clear, okay? So whatever clarity you're searching for, remember, it's going to ebb and flow. And please, guys, if you're watching this, share it, bring some people in, ask a question or a comment. Janie's saying, I wish I wasn't so scared all the time. I will never not be will I ever not be afraid? Janie, what I will tell you is you got to believe that there will be a time in the future where your fear will come down. You've got to be able to allow yourself to believe that there will be a time when your fear comes down. That is a key part of healing. I get so many people that come to me and they genuinely believe they're psychic, meaning that they know the future, and that future is this. I'm never going to heal, man. This is never going to get any better. I'm never, and they know with such intensity that they're never going to get better, and they don't know that. But that belief will keep them keep them from searching for the answers. So, Janie, all I can say to you is, you got to work on that. And I know you and I have exchanged some private messages about how to do that, but you got to keep talking that stuff out. But the main thing, Janie, is you got to keep working on Janie's relationship with Janie. Janie's got to keep working on her relationship with herself. She can't keep blaming the victim, hating herself, hating the trauma. All that negative emotion is being piled on top of the negative emotion of trauma. Okay, great. So again, some more questions. I'll come back to you in a sec, Janie. Sarana. Thank you, Sarana. Hello, doc. I'm in cycle where my productivity is pretty much non-existent. I suffer from PTSD, and my question is, how do I put my mind in check? Great question, Sarona. What I would tell you is, you got to get into that PTSD, sister. I mean, I'm assuming you're a woman, but you got to get into that PTSD. You got to figure out why is that PTSD still preventing me from putting my mind in check? And when you say mind in check, what does that mean? Does that mean, see, one of the things that I think I see over and over with people, clients, patients, is they think they're going to be healed, meaning that they're going to have their mind in check. Like Janie said before, I'm going to find clarity and then that's a done deal. Guys, that's not the way it works. It does not work like that. This stuff ebbs and flows. So Sarona, I think it is. I would encourage you to really start working on that PTSD. I don't know if you have or haven't, but whatever's going on with you, that PTSD, and you know, I've said this before, but trauma, unworked on trauma, is like an infected emotional wound. So if I have a wound on my arm, and I've got some other video, Saran, if you're coming from YouTube, check out the video I have on there about how to heal emotional wounds. I talk all about this, and that was 4 years ago. Okay. So if I have a wound on my arm and I'm not treating it, it's going to start getting infected and it's going to start pumping out infection into my bloodstream. And then I'm going to feel sick. Same thing with unhealed emotional wounds up here, guys. They're pumping out infection. And no, I'm sorry. If you've had a significant trauma from your past and you think a webinar, this, or a podcast, or a speaker, or whatever, you're going to be healed. It ain't going to work like that, guys. I mean, that's good stuff. That's better than not doing it. But you got to get into a situation where you can talk it out with somebody that can help you heal it. So, Sarona, if you're still watching, when you say, how do I put my mind in check? What does that mean? What do you mean by put my mind in check? Does that mean, I'm going to assume what you mean is, control my mind so that I am not continually flooded with negative thoughts and emotions? Well, the only way you're going to be able to do that, sister or brother, is you got to work. You got to get into that. Remember, I've said this before, this whole let it go culture, this whole culture of letting it go and just let it go and don't. That's the problem we have in our society. I hear some of that with Sarona's question. She's saying, how can I get my mind in check? Meaning, how can I get my mind in check and then not be affected by all this negativity? It ain't going to happen, sister, until you expose yourself to it. That's why I'm going to get to you in a sec, Rose. Thanks for the question. That's why exposure therapy is so powerful. If those of you who don't know it, exposure therapy. Sarona comes into my office. Well, let's say somebody else. Bill comes into my office and he's afraid of snakes. Imagine if I tell him, oh, dude, just let it go. Just let it go, man. And I start singing that song from Frozen. Let it go. You guys don't want to hear me sing. But anyway, what's going to happen to that? What's going to happen to that fear? Not a damn thing. So what I'm going to have Bill do is slowly, therapeutically expose him to his fear so that he can be acclimated to it. He can get used to it. He can learn how to deal with it. It's the same thing with trauma, but way more involved. That's why I keep saying to people, you got to find licensed people in this field. I know coaches they're all, they've got charisma and all this. Man, I'll tell you, a lot of them have way more views than me and way more followers, and that's more power to them. But they're not trained in mental health, okay? If you need a coach or if you need somebody to kind of like be empathetic and listen to you and feel your pain and so to speak, that's all good. But when it comes to working it through, sorry, you need someone trained. Just like if you were looking for a heart surgeon, you're going to find someone trained, a trained cardiologist. If you need brain surgery, you're going to find somebody trained in brain surgery. If you need eye surgery, I could go on. And I know it sounds elitist, but let me tell you something. We go through the training we go through and have the student loans we have and the debt and work our butts off in clinics and all that to get the training to know how to help people through these issues. Please get the right kind of help. So, Sirona, to close out, to get to some other people, you got to work on that PTSD. You can't keep being afraid of it and running from it and being ashamed of it. Guys, please share this if you're watching this. Please share this live video on your timeline to bring people in, okay? You've got to start working on that PTSD, Sirona. You can't keep just hoping that it's going to go away, sister, because it's not. It's not, and I don't know what degree of trauma you've been through, but if it's, like you said, you're suffering from PTSD, if you're suffering, sister, and if it's something you can't talk about, like I said before, whenever you say, oh, I can't talk about that, that's what you should be talking to. And you should be talking to someone trained and licensed in the field who knows how to help you. Okay? Not going to go into that again. Thanks, Sirona. Please, and if you have any follow-ups, please, I'll get back to them after I get. And Rose is asking a question about EMDR treatment for PTSD. But let me get to Rose's initial question. How do you handle a person who's suffering from cancer? Wow. That deflects their pain onto me and says I should commit suicide, slit my wrist. I've reported him, but it hasn't sat well with me over the past few days. I'm a surviving warrior from tremendous amounts of physical and mental abuse and survived a lot, but the mental abuse from that person has taken a toll on my well-being. Damn, man. Does it ever stop? I wear my heart on my sleeve. I feel bad for people suffering, so I try to help only to get burned brutally by this person. Well, Rose. Okay, I had one of my dearest friends die from testicular cancer. Okay, I actually named my son after him because he was such a close friend of mine. I don't know what stage of cancer he or she's in. I don't know what level of chemo this person's in. But sister, you got to draw some boundaries here. I don't know if it's a brother. I don't know if it's a former lover or current lover or whatever. But you need to tell this person, enough. If you continue to treat me and talk to me this way, you're going to go through your cancer alone. Well, you don't love me. You know I'm going. I love you. I care about you, but I care about me more than I care about you. Well, how can you say that? You're not the one with cancer. I understand. That's why I've been with you for so long. I am letting you know I will be with you and help you, but I will not be brutalized by you. I have my own issues, and every time you tell me to commit suicide and slit my wrist, you're traumatizing me. Well, this isn't about you. Yes, it is about me. You're not the only one suffering. And if this person does not want to hear you, Rose, you got to make the hard decision, sister. You got to do what's right for Rose. Okay? And yes, I am not a believer that you need to continue to be abused by people in your life who are family, who continue to abuse you, who continue to say, I'm sorry, and then continue to do the same thing again. You got to draw boundaries with people because ultimately my relationship with myself, and I used, and there's when I say that, it co-runs is my most important relationship, but with that is my relationship with my wife and my son and, of course, God and all of that. But all I'm saying is, Rose, if you're suffering the way you are at the hands of somebody else, and yeah, my heart goes out to cancer people, but they do not have the right to abuse you, sister, okay? They don't. And you need to start saying to this person, not in a mean way, you mother blanker, son of a, you can just calmly say, look, and find them when they're calm. Like I told, we were talking about before, calmly, catch them when they're in a down spot, laughing. Hey, I need to talk to you. Listen, I don't want to fight, don't want to hurt you, but you can't talk to me that way anymore. Okay? I know you're struggling. I know you're hurting. And give them some context. Give them context. Tell them why you can't deal with that anymore. Tell them why. Give them context. But Rose, my clinical advice to you is, especially if you've gone through, as you put it, You've survived a lot of mental abuse. You've survived a lot of physical abuse. You're getting traumatized by this person, and that's not going to help you grow. Okay. And I don't know what you're thinking about. I got to be loyal to this person during a cancer. And that's all beautiful. You're an empath. You care. You got to be empathetic with yourself. You got to feel for yourself first. So I would recommend that you draw some boundaries, talk to the person first, give them a chance to change behavior. And if they don't, you may have to make the hard choice of, I can't deal with this, or backing off to a certain degree. Well, how am I going to deal with if they die? How am I going to deal with this? You're going to remember all the times you tried to help the person. Okay, you're going to focus on all the things you did for the person. Okay, so I'll get to your second question in a second. Stage 4. Okay, yeah, I hear you. So let me just get to Clara. Thank you, Clara, from YouTube. If you're watching us on YouTube or Twitter or Facebook or anything else, then please share it so that we can pull some more people in. Remember, the reason I'm doing this and not charging anybody is because I want people to see what talking to someone like me is about, what it really is. It's not this Dr. Phil crap you see on TV. It's about an exchange of ideas and thoughts with somebody that's equal to you. I am no better than you. We are equal. Okay. So Clara's asking, Dr. Walker, I am extremely sensitive. Little things hurt me and I cry easily. How do I toughen up a bit? Thank you. What's that song? Oh, I forgot that woman's name. Thick skin, thin, elastic heart and thick, or something like that. Anyway, I don't remember. It's a great song. But okay. So what I would say to you is this, Clara. What's going on with the little things hurting you and crying easily and being extremely sensitive? That I'm hearing trauma. I'm hearing something happened to Clara when she was a little girl, where she was either abused physically, maybe sexually, definitely emotionally. Meaning there's somebody was picking on you, was putting you down, was being very mean to you. Something like that. So if you're still on, fill me in. Tell me if I'm way the heck off base or if I'm on the right track. But whenever somebody is extremely sensitive, oh, and by the way, I'm guessing that Clara's extreme sensitivity also makes her an extremely sensitive person to other people's feelings. Meaning that, I posted this years ago, but it was a meme, just said, easily hurt people don't hurt people easily. So I'm guessing that Clara is probably very empathetic and very sensitive to, sorry, someone's texting me and I just want to make sure they're not in crisis. Okay, we're all good. So Clara, you've got to figure out what's going on. What trauma is sitting in there? Okay, true, Dr. Walker. Okay, great. So that's what I would focus you in on, sister. And it's not going to happen tonight. It's not going to be, oh, I'm magically healed from one webcast for this bald-headed guy. It's not about that. It's about you finally saying to yourself, yeah, I've got to deal with whatever trauma I have gone through that has caused me to be easily sensitive. So I'm going to keep going then. So you were either put in a position as a child where you were hurt a lot, and then nobody helped you with it. You were either alone with that pain and nobody taught you how to deal with it. So it just sat in you and grew in you, and that caused you to start hating yourself and things like that. My recommendation, if you really want to toughen up a bit, you got to work on that underlying trauma, sister. You do. You got to work through it a little bit, face it, get with somebody who can help you work through it so that you can begin to realize that that's what's going to toughen me up. See, the thing about trauma, remember, there's post-traumatic stress disorder on one end. So trauma's on a spectrum. Imagine this is a big, long line. How do I get that? Okay, great. On one side of the spectrum is post-traumatic stress disorder. On the other side of the spectrum over here is something called post-traumatic growth. Now, if none of you, if you've never heard of post-traumatic growth, I highly recommend that you look up post-traumatic growth, and you see that there's a whole bunch of information out there written by victims of abuse or who have survived great traumas and have grown from it. Now, how have they grown from it? They've worked on it. almost 95% of the people who have gone through trauma and have turned it into post-traumatic growth have worked on it. I was watching an interview with a lady who gave me goosebumps with my wife a few weeks ago, and she was talking about she lost her leg, and the interviewer at the end asked her, because she was talking about how it's changed her life and how she's gone on a different journey now, and she would never, and the interviewer asked her, and it was a great question, if you could go back in time, would you change the factors that made you lose your leg? And she looked off for a minute and thought, no. And she said no. And that just gave me chills, because what that meant was that she had worked on that trauma to a degree that then she began to see it as something that ultimately helped her grow. So what I'm guessing, Clara, and again, please. Okay, thank you so much. I need a lot of work. Did not think of this. Okay, thank you, Clara. But remember, the fact that you need a lot of work, there's nothing to be ashamed of. Okay, if you're still on, please, when you say I need a lot of work, there's nothing to be ashamed of with that, because Clara, let me take a wild stab at something, sister. You didn't ask for the abuse. You didn't ask for whatever has caused you to be so hypersensitive. Okay? Now, Clara, remember, like I said before, I'm guessing that you are a very sensitive person, and meaning you don't like to hurt people's feelings. That's the post-traumatic growth. The part of you that is empathetic and cares, hi Miranda, I'll try to get to you in a sec, that cares about not hurting people. Don't stigmatize that. We're moving into this culture where I don't give an F and I don't care and people think that's healthy. Let me tell you something. There are multiple severe mental illnesses associated with not caring. The last thing we should be doing as a culture is moving into not caring. We need to actually move way more into caring. Okay? So Clara, just because I need a lot of work, do not look at that as a bad thing. Look at that as a challenge. And Clara, you don't need as much work as you think you do, sister. All you need to do is start integrating that trauma into you. Stop being ashamed of it. Stop looking at it as a bad thing, and begin embracing it as something that can help you heal, help you grow. But it takes work. It takes work. And I'm guessing that, like you said, quite honestly, I did not think of this. You need to start thinking about it. But and Janie and other people have heard me say this before. Clara needs to take It's Okay pills. What's an It's Okay pill? It's okay that I have this trauma. It's okay. It's okay. It's okay that I have trauma from my past. People who have been traumatized hate their trauma at such a degree, and they blame themselves for feeling what they feel, as though they asked for the trauma. As though they were little kids going, oh yeah, can you please traumatize me? Can you please hurt me? I want to struggle with this the rest of my life. Okay, Clara? So please, sister, find somebody in your area or online that you can work with and start dealing with this. The first step is saying to yourself tonight, look in the mirror when you get off this broadcast. It's okay that I need some work. And it's not a lot. It's okay that I need some work. I like the fact that I'm sensitive. I like the fact that I care about and I don't like to hurt people's feelings, okay? I like that. Clara, that's why you're predominantly mentally healthy, because you don't like hurting people. People who have been hurt a lot don't generally go around hurting people, okay? Not generally. There are a lot of people who have been hurt a lot and haven't dealt with it, and they're angry and they act out on people. So I'm obviously well aware of that. Okay, great. We got people interacting. Let me go back up here because Rose asked a follow-up. What do I think about EMDR treatment for PTSD? You know, Rose, I don't use it. I haven't been trained in it. I hear that it can be helpful. You got to find the right provider. You have to find somebody that knows how to do it. So when I don't know, believe me, I know this breaks every rule of somebody on the internet, but when I'm not an expert on something, I don't really like to talk about or give people advice about it. What I would recommend is you look into it, maybe pay for some journal articles about it and read some of the studies. There get some interesting results. There've been examples of people who have results. I think Janie said, I went through a year of EMDR therapy for my sexual assaults and felt alive again in 2011. Great. So, Janie, maybe you and Janie can talk about how it's helped you. Janie obviously has talked openly about the fact that she still has work to do on some of this. So remember, guys, there's no silver bullet here. There's no panacea. I know that you'll see people online and they'll be like, oh, my podcast will save your life, or my book. No. If you've got a moderate, some people have more mild and some people have little, if any, trauma. But if you have mild to moderate to severe, more in that bell curve where most of us are, you're going to need to work on it. You're going to need to spend some time assimilating it into you, talking it out, being in a situation where you can say, you know what? I'm not going to curse, but F this. I'm not going to be ashamed of something I didn't ask for. I'm going to start working on it. Again, guys, if you're watching this, please share it so we can bring some other people in. So Rose is saying stage 4 cancer. Wow. Yeah. So I think I talked about that before. Sarana is following up saying, this is it in therapy. I do cut around the bushes, and I don't know why, but I guess it is sense of safety and control of choosing not to put the information out there. So you're in therapy, Sarona, and you're dancing around the bushes. Say that in your next session. Okay? Go in there and say that in your next session. You know what? I've been dancing around the bushes because I don't maybe feel safe or a control of choosing not to put this information out there. Make that the topic of your next session. Okay? Because if your therapist is relatively good, they will use that information to help you start talking more. Okay? So if you're in therapy and you're not talking about the trauma, then clearly you're ashamed of the trauma, or you're worried about what talking about the trauma is going to do to you. And guys, I know that it's scary to face the demons. I get that. I've talked openly about my own issues. What has helped me the most is talking a lot of this stuff out, working on it, and not being ashamed of it. So I can tell you from a firsthand experience, talking it out is better than keeping it in, okay? So let me know how things go, Sarana. I'd be interested if you can do that in your next session, okay? This is my challenge to you. Talk and say, you know what, I've been dancing, I've been going around the bushes, so to speak, or, I don't know why, but I guess it's because of safety and a feeling of control and choosing not to put this. Talk to your therapist about that. Because if I had a client like you, sister, and I'm very grateful, and my clients know this, and I say this openly. I am very grateful for their financial assistance in my life. So I work my ass off in my sessions. If I had a client that was doing this, I would want to know that. And I'm guessing your therapist wants to know that. Okay. Let me just see. I'm going to get to your follow-up, Rose. Let me just see if anyone else has chimed in. Okay, so let me back up here for a second. Miranda is asking, I know this may be comparing apples to oranges, at least that's how it is presented to me, but what are your thoughts on emotional and versus physical abuse? I have a friend that told me that someone's gone through emotional abuse can get over it, no scars, let it go, where physical abuse, you don't have the luxury, in quotes, and physical abuse doesn't heal and it can kill you. Okay, great question, Miranda. What I will say to you is this. We don't need to look at it as an emotional versus physical abuse. Okay, there's no need for them to be in competition. They are both equally damaging. Physical abuse doesn't heal and can kill you. Sorry, I don't know who told you that, but no offense to them, but they don't know what they're talking about. Somebody who has been physically abused and doesn't work on it, then it ain't going to heal. And it can kill you, absolutely. But generally speaking, if you work on the physical abuse, if you get yourself into a therapeutic environment where you can talk it out, I am a firm believer, and this is, again, remember, this isn't me, I am a former executive and I am telling you 20 plus years in the field, everybody has the capacity to heal. Everybody. The key is you've got to work on the wounds. So, Miranda, physical abuse and emotional abuse, they are both abuse. Now, sure, dramatic physical abuse and being beaten, and I've worked with many of those clients, versus, oh, you're just a piece of crap and teasing. Sure, that type of physical abuse is going to be more significant than emotional abuse. But what about emotional abuse where you've been ridiculed your whole life, told you're a loser, told you, yeah, I wish you were never born. No physical, told you this and that. But let's say the physical abuse on another person is they were beaten a few times, no big scars, but they were beaten in such a way that it left a memory of it. Now, which one outweighs? The thing about abuse, like trauma, everything's on a continuum. Okay, I am fully cognizant, and I talk to my patient clients about this all the time, that if I was severely physically or sexually abused, I don't really know how that would have worked out, because I came from such a emotionally stunted family that I think if I was sexually abused or physically abused, I don't know how I would have dealt with that. I really don't. I want to believe that I would have sought out treatment and worked through it, but I know the psychological and emotional crap we went through. In many ways that I'm in some ways I'm still healing. I'm still needing to work on, because it comes out in things I learned, and I keep working on it. But so anyway, no, the last sentence I categorically don't ascribe to, the idea that physical abuse doesn't heal. It can kill you, sure, but it doesn't heal. Now remember, the idea of healing. There's, like I tell my clients, there's no healed, it's healing. We have to be in a constant state of healing, and healing takes work. Okay? You got to work on your healing. So people who are actively working on their physical abuse, absolutely, it can heal. It can heal to the point where it doesn't have to kill them. It can. And I'm not just saying that. There are plenty of examples out there. Like I said, read the literature on post-traumatic stress disorder. Post-traumatic growth. And you'll see that people can heal. So thank you for the question. That was a great question. Okay. Those are my thoughts on emotional versus physical abuse. They don't have to be versus. They're both equally damaging, but you have to work on them. So Miranda, agreed. Great. Sainieta, sorry, I'm late. That's okay. You can check it out later. Will do, doc. Thank you. Great. Let's just see if anybody, Reiki and yoga. Yes, Rose, absolutely. Okay, no one else has asked any new questions. So what I will do as we close out here is remind everybody watching that you're welcome, Miranda. And seriously, if it's you, if there's something going on within you that you haven't worked on, if there's physical or emotional abuse within you, you got to work on that, because there is absolutely nothing wrong with having wounds from our past. Okay, I hear this garbage on the internet all the time. My past doesn't affect me. I'm done with it. Okie dokie. So can I talk to you a little bit about your past? Oh, no. I don't need to talk about it. Oh, you don't want to talk about it. That's interesting. Remember, whatever you don't want to talk about is what you should be talking about, is exactly what you need to heal. So anybody out there, you're welcome, Clara. Thank you. And seriously, Clara, I'm serious about this, okay? Your ability to feel for other people is a byproduct of your trauma. That is a positive thing, but you've got to work on Clara's relationship with Clara, because I'm guessing that you are your own worst enemy. You abuse yourself. You got to keep working on that. Okay. Excellent. Amanda's chiming in, one step at a time, one day at a time. Healing is a process. Absolutely. And Amanda's working on hers. Okay. Zenyatta's working on hers. And it's a one step at a time. But the key is, one of the keys is relationship with self. So what I will leave you guys with is this. Nobody asked for these emotional wounds. Okay. Nobody asked for to be abused like this, like they were. Okay. There's nothing you should be ashamed of if your past is still affecting you. I'll quote that line I did from the last one. You may be done with the past, but the past ain't done with you if you're not working on it. Okay. Miranda's saying, sometimes I think I'm too empathetic. Yes, empathy. Trust me, guys. Too much water can kill you, Miranda, sorry. Too much food can kill you. Excellent, Rose. The serenity prayer, absolutely. Control the things I can, and the wisdom to know the difference, absolutely. So yes, Miranda, you got to work on that ability to empathize. I have to do it every day. I have to be able to manage not feeling too much for the person, because then I cross boundaries and I'm not able to help them in a way. So you've got to work, and being too empathetic from somebody can also weaken the other person, because then they stop needing to feel for themselves. So yes, definitely, Miranda, you got to work on that empathy. And I can't remember who was it that was talking about the abuse they were suffering. Oh, it was Rose. Rose was talking about the abuse she's suffering from somebody close to her that's struggling with cancer. Rose, I'm challenging you, sister. You got to start taking care of Rose, and you got to start doing what you need to do to heal Rose, okay? Yes, Miranda, it may get you into trouble a lot, but I'll take a world of overly empathetic people over a world of unempathetic people any day of the week and twice on Sunday, okay? I consider myself extremely empathetic, but I've learned how to manage that in a way and set boundaries for myself. Because please don't think I have this perfect extended family where we're all just, it's quite the opposite. I have had to lay down. I've given people multiple chances, and they continue to do things that cause me pain, cause people around me pain, and sometimes you need to draw boundaries, okay? And how you draw the boundary is up to you. So anyway, guys, thanks for tuning in. Please, if you haven't checked out my YouTube page, there are more videos on there that aren't on Facebook. Please subscribe to that page, please. The more subscribers I have, the more YouTube knocks up my viewer rate, which then more people can get help. Oh, Severina, yeah, you missed a lot. But you can check it out on the delayed or whatever it's called. But Severina has also been a great supporter here and talked a lot about some of the stuff she's currently going through. I was reading some of your posts again, Severina. It sounds like you went through a lot with your mom and her forcing you to make a decision you didn't want to make. Can't be easy. So thank you, Jennifer. Thank you. I appreciate that you're sharing this in a party. And I say too much, sorry. But let's continue working on our mental health, guys. Let's take this and grow it and make people understand that there's nothing wrong with having a degree of mental illness. None of us asked for these injuries. None of us asked for these wounds, but you got to work on them. And you can't hate them, and you can't hate yourself. I mean, you can hate yourself, but hating yourself is literally compounding negative emotion on top of negative emotion. So thank you. Dennis, how you doing? Just listening tonight. Great, Dennis. I hope things are, you got a lot going on. I don't know what happened, with your wife the other night when after she got home from going out. I hope you guys are talking. I know that it's very difficult to be in a relationship where, you got to deal with a bunch of things you normally wouldn't deal with, but thanks for tuning in. Richard, what are your feelings towards virtual reality exposure therapy? Send me that quote. What quote? Jennifer. Sorry, I sometimes say a lot and then I forget. So virtual reality exposure therapy. What I'm thinking that is, because there's so many different forms of therapy, is that when you use the screen over your eyes, um, I just hope whoever's doing your virtual reality exposure therapy has a license in virtual reality exposure therapy. Okay, Richard? So whoever, if you're doing it to yourself, um, you start exposing yourself to things you're not ready to deal with. There's a thing in exposure therapy called flooding. And I talked about this in a previous broadcast about VR, right? Okay, that's what I thought. So thanks, Severina. So I would just be careful that you're not doing, well, anyway, I was talking about before the guy from the sniper guy, the American sniper guy who took the PTSD veteran to the shooting range. Sorry, it's Friday, and he flooded him with too much, the sounds of the guns and everything, and the guy shot him and killed him. And now we've got this guy dead. And I would have recommended that guy, please don't do that. Has the guy had gotten any therapy? So Richard, I'm a huge believer in exposure therapy. It's a great way to work on letting yourself feel things that you've never felt before, but it's got to be done by somebody who knows what they're doing, brother, because if you flood yourself with too much, you can have a negative result from it. And VR, from what I've read about it, it's such an intense experience in front of you that you got to be careful of what you're doing. So my feelings towards it are, if it's done by somebody licensed, somebody professional who knows what they're doing, not somebody who bought a VR headset and now they're going to be a virtual reality exposure therapist. Okay. So Richard is saying problems with desensitization. Don't know really what that means. Maybe you're too desensitized or you're not sensitive enough. Maybe you've had some trauma that's caused you not to be that emotional. You got to work on that, brother. You got to. Okay. You got to. So I'm going to log off here. Are repetitive dreams that are traumatic really flooding and flashbacks? Yeah, Janie, definitely. I talked last week or another broadcast that a lot of dreams, a lot of things that come out in our dream state is our brain trying to heal. Okay? Our brain trying to heal. So it's exposing itself to these traumatic things in a way to get it out of itself. Okay? So yes, definitely. And if you're having repetitive dreams that are traumatic, sister, there's more, and I'm glad the EMDR helped you to a certain degree, but there's stuff in there that needs to come out in a therapeutic way. So Richard, I wish you'd have logged on earlier, my brother. We could have talked a little bit more about what your problem is with desensitization. I don't know if it's from a traumatic injury in a war, or if you had an abusive dad, or if there's some trauma from your past you haven't dealt with. But brother, you got to work on it, because those unhealed emotional wounds are bleeding all over people around us. Okay. Sabrina's saying sometimes we're in a hurry to be okay again. Exactly. That we end up worse. Exactly. And that's why the It's Okay pill, that I own that domain name, theitsokaypill.com. It's okay and remember, now it's all over the place. And I've been saying this for years. It's okay to not be okay. Yes. But it's also okay to hurt. It's okay to have been traumatized. Not it's okay that someone traumatized you, but it's okay that you're still feeling that trauma. And men, you're welcome, Richard. Men, we are the worst offenders of keeping stuff in and it coming out. That's why they say anger is a secondary emotion. And if you can tell, guys, I could go all night, but it's Friday night. My wife's been waiting for me to watch a movie, so I got to log off. Because I love her dearly, and I've got to keep my own boundaries. So thank you for logging on. Please share this. Please work, Richard, on whatever is causing you to be desensitized, my brother. There's nothing wrong with being hurt. There's nothing wrong with being scared. There's nothing wrong with feeling like a little kid inside, Richard. You got to stop beating up that little kid. I call that inner child abuse. You got to stop abusing that inner hurt child. Whatever happened to you, You got to start working on it. Okay, guys? So again, please share this. I'll see you Monday night. Monday, let me put that up again. Monday, Wednesday, and Friday at 9 p.m. I'm going to keep doing them 3 nights a week as long as people are logging on. If it starts dropping off, I'm going to have to change the format. I'm going to bring some guests in. I've got somebody who made some comments on a previous show, exchange some messages, and he's willing to talk a little bit about his journey and his healing. If any of you want to, please send me a private text message to my number. You're not going to get spammed. You're not worried about any of that. If you'd like me to interview you, this streaming program has a way where I can bring up we don't have to use your name, and you can just talk openly with me, and we can go into it a little bit and give people an idea of what the process of healing is like, but from working with somebody. Okay. So again, anybody wants to come on, here's the number. Please write it down, shoot me a text, and we can coordinate. I'll let you know what we're going to ask, so you're not, what's the word? Scared, or I can't even think anymore. It's been a long week. So anyway, thank you everybody for tuning in. Thank you for your support. Really appreciate it. Please share this. Please tell people about it. And I'll see you Monday night at 9 p.m. Okay? Have a great weekend, and